Hello, everyone. Today I'm going to speak about my PhD thesis, heart rate variability and depression, patterns across health and disease. As you said, my name is Shir Galin. I'm a psychologist and a first-year PhD student. My vision is reducing mortality and improving lives through psychology, and my mission is integrating psychological dimensions into everyday healthcare and policy. I will do so by embarking in two projects. Both of them have started these past 3 months. I'll start presenting the first one, is investigating the accuracy in predicting depression through heart rate variability in healthy population, which is a systemic review and meta-analysis. So why would I research that? Because depression affects over 280 million people worldwide and has substantial health and mortality risks. As you can see on the top right of the slide, suicide is the first cause of death in the ages between 15 and 29, and major depression actually increases suicide risk by 20-fold. Another small example, depressed heart failure patients have double the risk of dying within 2 years. That, in turn, costs a lot of money, and it burdens the economy with over $1 trillion annually. So we have a problem. The problem is that we have no biomarkers for depression, so rely only on subjective measures. So if I'm, as a psychologist, want to diagnose someone with depression, I will just ask him, how are you? What is your mood? Okay? It means that I have no early detection. And that also costs a lot of money. Okay? As you can see on the bottom right of the slide, the direct medical costs are 150% higher for people with unrecognized symptoms of depression. So we know that heart rate variability, which is actually a cardiac measure, is lower in individuals with depression. And our aim is to investigate the relationship between heart rate variability and depression to enhance early detection and prevention strategies. We will do so by using the following clinical question. Does lower heart rate variability precede depression in healthy adults? The model will be PFO, P for healthy population, the factor will be HRV, and the outcome will be development of depression. The hypothesis is that healthy individuals with lower HRV have increased risk of developing depression. The clinical implications are vast, because using HRV as a biomarker for screening for depression, it enables us early prediction of depression and early treatment. The systematic search was conducted with 2 domains. The first one, HRV, and the second one, depression. The systematic search was done by the 3rd of November in 4 different databases, PubMed, EMBase, Cochrane Library, and one which is solely for psychological research, and it's called PsychNet. As you can see here, we have a few key articles. All of them study a healthy population that varies between adults and children, but we will look at all of them as healthy human beings. The outcome is always depressive symptoms, but the outcome questionnaires vary, so we will mathematically adjust them. The follow-up period also is changing between a few months and more than 10 years, so we will divide it by above 1-year follow-up and below 1-year follow-up. The systematic search yielded approximately 18,000 results, and after duplicate removal, we have 12,000 results. We are now in the title and abstract screening phase, due to end by the middle of December. Let's proceed to my next project, exploring the association between multiple sclerosis, depression, and heart rate variability, which is a prospective observational study. Almost 3 million people are diagnosed with multiple sclerosis worldwide. And we know 2 things. That first, MS is a neurodegenerative disease, and it impacts the central nervous system and autonomic functions, including HRV. We also know that the prevalence of depression in MS patients is extremely high at around 30%. Okay? And for comparison, in the general population, we have approximately 7 to 8% of depression, so 30% is huge. And we have also two morbid outcomes. That first, MS patients with depression have a faster progression of disability, increased physical symptoms like fatigue and pain, and lower quality of life. Also, lower HRV is a predictor of both physical and psychological health outcomes, all of which can have serious implications for MS patients. So our problem is that both depression and MS contribute to reduced HRV, making it very challenging to determine whether lower HRV is due to MS released nervous system damage or to depression or a combination of both. So our aim in this research is to determine the source of the reduced HRV to improve targeted treatment strategies for better patient outcomes. We will do so with the clinical question, does heart rate variability differ between depressed and non-depressed multiple sclerosis patients and compared to depressed and non-depressed healthy controls? As you can see on the right of the slide, we have 4 groups. And the model will be PEECO, the population will be adult patients, the exposure will be either to MS or depression or the combination of the both of them, C for matched controls, and the outcome will be HRV. Our hypothesis is that patients with MS and depression will exhibit the lowest HRV, followed by MS patients without depression and individuals with depression alone. All these groups will experience lower HRV than healthy controls. If we can answer this question, we have both research and clinical implications that will help us guide targeted treatments to improve patient outcomes. So, as you've seen here, I have 2 projects. The first should be submitted by September 2025, the second by September 2026. I would like to conclude with the words of Gabor Mate, who is a physician from Hungarian descent. We may not be responsible for the world that created our minds, but we can take responsibility for the mind with which we created our world. Thank you for your attention.
I would like to know what are the factors that can influence HRV. For example, is doing sports regularly, can it elevate the value?
Well, many outcomes or changes in our lives can change HRV as well. Okay, so it can be physical activity, it can be menstrual cycle, it can be age, all kind of things that we do. And we actually, as a psychologist or even doctors, we can elevate the HRV by doing a very small change by using a biofeedback. Okay, so we can change HRV, and it does changes around our lives.
How can you define the target population who needs HRV analysis? What is your idea?
Well, I know for now that how we do it now already. Okay, we treat patients with lower HRV. I work in a heart rehabilitation center, and we target the treatment to those who show us lower HRV, or depression, or both. So we do check it, but we are doing it, like clinically, and we don't know exactly on what we stand.
Many patients who suffer from depression also have anxiety symptoms, and many people with chronic diseases like MS also suffer from anxiety. How do you screen for patients suffering from anxiety? Because those can have a different clinical profile. Thank you.
Well, you're very right. We will adhere to the DSM criteria, but you are right. There is a huge comorbidity between anxiety and depression. Okay, so we will try in this research to take both into consideration, but then to make the analysis on the depression part. But usually when we do research in the clinical aspects of depression and anxiety, we will diagnose both, like we will check for both, and then we can just defer the one who has depression and the one who has anxiety. But it's different clinical questions.
I would like to ask, what do you think about do patients who got pacemaker or ICD devices, are they in higher risk of depression?
I love this question because it's very, very connected to what we see in the field. We see that people with a pacemaker usually will have anxiety. But till now, we thought, when we speak to them, okay, that it's because of their diagnosis and because of the outcomes they experience, which is like sometimes a sudden change of their cardiac measures. So I don't know to tell you now if it's because they sometimes have lower HRV, okay? But it's a crucial thing for us to know. So I don't know how to answer that, but I just know that it's important.
Thank you.